You are welcome to my channel. Today I'll be addressing chlorpromazine. Chlorpromazine. Chlorpromazine could come under the trade name Lagati. As a matter of fact, this word is very common in many countries, Lagati or Teva chlorpromazine. It belongs to the class of medications known as phenothiazines. It is a typical or first generation antipsychotic. Let me repeat. I am not saying atypical. It is typical. First generation antipsychotic. It is an antimanic agent, also an anti-emetic agent. It could appear in forms of tablet per oral as hydrochloride, and in that case, it will be in generic form with 10 mg or 25 mg, 50 mg or 100 mg. Can be a solution for ingestion as hydrochloride, and we can find 25 mg per ml or 50 mg per 2 ml. Administration. You can give chlorpromazine per oral with loss of water or milk or with food. Why that? Just to reduce the gastrointestinal tract upset. When you want to give chlorpromazine intramuscularly, please use the gluteal muscle and do that very slowly. Intravenous administration of chlorpromazine should not be like other medications. First of all, dilute before you give it intravenously. And when you want to give chlorpromazine intravenously, please give it very slowly at the rate of 1 mg per minute. And let the patient remain on bed for at least 30 minutes. The reason is it can shut down the blood pressure pretty fast. Severe hypotension. As a matter of fact, I'm not comfortable giving chlorpromazine intravenously. Note this, there might be spilling, and when it spills and touches the skin, it can cause contact dermatitis. Uses of chlorpromazine in schizophrenia, in hiccups, bipolar disorder, in aggression or agitation. Useful in hyperactivity, in tetanus, preoperatively for restlessness and apprehension, for nausea and vomiting, particularly cyclic vomiting, or chemotherapy-induced nausea and vomiting. Also helpful in handling severe migraine. Mechanism of action. Chlorpromazine blocks mesolimbic dopaminergic postsynaptic neurons in the brain. It depresses the release of hypothalamic and hypophyseal hormones. Depresses the reticular activating system by having effects on basal metabolism, body temperature, wakefulness, vasomotor tone, and emesis. How can we discontinue chlorpromazine? Please, no cold turkey here. So no sudden discontinuation. No. If the patient cannot tolerate chlorpromazine, we have to switch to a more tolerable medications. Remember, this is first generation antipsychotic, right? You can choose second generation antipsychotics. If we must change to another medication, we have to start the new one with a low dose while gradually decreasing the dose of chlorpromazine. We have to continue to increase the dose of the new medication while we'll continue dropping the dose of chlorpromazine more and more over weeks. And in some patients, can take months. So it's risky to stop cold turkey, please. The degree of dosage reduction would depend on the condition that chlorpromazine is being used for. If we stop suddenly, that is cold turkey, we will run into withdrawal symptoms. And someone is asking, what are the withdrawal symptoms? In a bit. That will include psychosis. Remember, it's being used to handle schizophrenia, right? And you are stopping it suddenly, then you are back. You're back. Tremor, restlessness, dyskinesia, diaphoresis, agitation, all because you stop these medications suddenly. Now you are dealing with withdrawal symptoms. Also, withdrawal symptoms will include insomnia, somnolency, rhinorrhea, vertigo, myalgia, irritability. You can run into anxiety, paresthesia, respiratory distress, hyper or hypotonia, with warmth and chills in some. What are the possible adverse reactions? Okay, neuroleptic malignant syndrome is pretty possible. There will be a self-representation on that in a bit. Extrapyramidal side effects presenting with acute dystonia close to the time of administration. Akathisia with restlessness. Parkinsonism-like signs and symptoms. And of course, later on, can run into tardive dyskinesia. Still on adverse reaction, there might be syncope. Hypotension. That is the reason why I would not likely give it intravenously. But then, if it must be given intravenously, given very slowly after being diluted. Now, prolonged QT. And I want you to pause and listen very well. Prolonged QT will lead to tozadipine. If there is no correction, tozadipine will lead to ventricular tachycardia. It can start with monomorphic ventricular tachycardia, then getting worse to become polymorphic ventricular tachycardia. Without correction, that will lead to ventricular fibrillation. Without your defibrillator, the ventricular fibrillation will lead to asystole. Without instituting advanced cardiac life support intervention quickly, calling code blue if it is in hospital, then there will be death. The patient will end up in the morgue. Tachycardia and skin rashes, laryngeal edema, worsening of asthma to those that have been diagnosed with asthma and taking chlorpromazine. So note this, if you're an asthmatic patient and maybe because you have schizophrenia or you have recalcitrant nausea and vomiting, you have been given chlorpromazine, either chlorpromazine or Lagati or any other brand name in your country, and you are a non-asthmatic patient, then let your doctor, and you review this presentation. Your asthma may not be controlled properly again with your POVAS. Nausea, of course, someone will say you are using the same medication for nausea and vomiting, now side effect is nausea. False positive pregnancy results. Yeah, maybe this woman has been hoping to be pregnant before and now on chlorpromazine, and you have your kid at home, you've tested yourself and it's giving you the sign that you are pregnant and say, whoo, hurrah, I'm pregnant now. No, watch it. It might be chlorpromazine that's giving you that false impression. Or you don't want the pregnancy and suddenly you just have a pregnancy test and then it's positive because you're on chlorpromazine. Don't kill yourself yet. No, don't. Make sure you discuss with your physician. It might be chlorpromazine that has given you that false impression. Priapism in men. And of course, impotency is possible. Still on adverse reaction, there might be increase in appetite. And when there is increase in appetite, you know what is going to lead to, right? Weight gain. Some will have paralytic eye loss, meaning the intestine will not be, contracting, and peristalsis will be slowed. And if that is the case, what are we going to be dealing with? Constipation. Constipation, urinary retention. Aplastic anemia, granulocytosis, hemolytic anemia, immune thrombocytopenia, leukopenia, and jaundice. In fact, I remember, now somebody close to me once asked me, if these medications will give all this, then why using them at all? Well, my answer then and today is that we can't be watching this patient who will have schizophrenia and some other conditions untreated, right? Then we'll always choose the medications with the least side effects before moving on to those that will likely have more side effects. And finally, it is not all these side effects that must happen in everybody, and not all of them will be present at the same time. So, your eyes may not be spared. You can have visual impairment, lens deposit, corneal deposit, miosis, cataract, mydriasis. Increased lactation and breast engorgement can occur. Nasal congestion, hypersensitivity may present with anaphylaxis or angioedema, just because they're using chlorpromazine, right? Now, contraindications, meaning when can we not use chlorpromazine? You don't use chlorpromazine if there's hypersensitivity to phenothiazines generally. If the patient is in coma, please, no chlorpromazine. If this patient is someone who boozes a lot, alcohol, and he or she has even taken alcohol right now, please keep chlorpromazine off the table. Someone has just been given barbiturates, or there is a lot of medications that this patient can take at the same time. If barbiturates or opioids are on the table, take your Lagati off the table, please. So, don't give chlorpromazine with alcohol, don't give with barbiturates, don't give with opioids, never in somebody in coma, and not in anyone with history of hypersensitivity to any phenothiazine. 1. Remember, this has anticholinergic symptoms: dry mouth, urinary retention, arrhythmia, constipation, and so on like that. Remember, these can give prolonged QT. I've just explained. You can rewind to know what is happening with tozadipine, ventricular tachycardia, that is monomorphic, to polymorphic ventricular tachycardia, ventricular fibrillation, asystole, and death. And of course, left-right arrhythmias like ventricular fibrillation. Vomit aspiration is possible when you are using this medication to handle hiccups. So, watch out. We must also remember that there could be fetal agranulocytosis. So, we have to have our complete blood count done, and particularly the differential white blood cells. There might be increased rate of falls. So, if anyone is on this medication, we must advise against that, and also that he or she must not carry out tasks that requires alertness, like driving, operating forklift, pilot flying the plane, sailor manning the ship, and so on. There may be dysmotility and aspiration along the esophagus. Let's have that in mind to prevent aspiration pneumonia or aspiration pneumonitis. Hypotension, like I've alluded to before now, is a big issue. In addition to that, there may be bradycardia. We should take note of that. Still on warnings, remember the relative malignant syndrome as part of the side effects I've stated earlier. Avoid unnecessary sunlight exposure. And why that? Chlorpromazine can lead to urticaria-like rashes if you have taken in and you are now tanning under the sun in summer. It can lead to temperature dysregulation. So you are on chlorpromazine and you are in a region with degrees Celsius of 32 to 40 to 45 degrees Celsius, and you are piling your body with lots of clothes, please, you might have a stroke. Yes, it's likely. Don't use an elderly with psychosis-related dementia. No. Be careful in the face of hepatic impairment. In myasthenia gravis, be careful. In renal impairment or respiratory diseases, be careful. I've given an example of asthma, right? In Reye syndrome, be careful. In anyone with seizure disorders or brain injury, the best advice is just don't use chlorpromazine in all these situations. Now, drug-drug interaction. Because the list is pretty long, please contact your pharmacist or your clinical pharmacologist. And of course, follow the protocol in your jurisdiction or in your hospital. Now, monitoring. We have to monitor the mental state of the patient, the blood pressure, heart rate, respiratory rate, temperature. Someone will say, why didn't you say vital signs? I've decided to list everything because my presentation is not meant for nurses and doctors only. It's for the entire world, anyone who understands English. So it might be patients that will be listening to this at home or at work or camping somewhere. So that's why I've decided to put everything here. So you measure all this every 6 months, including weight gain and lipid profile. You measure all of them every 6 months. Then complete blood count, particularly the granulocyte. Why that? Can you supply the answer? Let me listen and get what your answer would be. Okay. Agranulocytosis. So we want to know what is happening to agranulocytes. Hematocrit. Why that? Let me get your answer. Okay, you got it right. Anemia. Okay. You do that PRN as may be required, and liver function test every year. Still on monitoring, you take serum samples just before the next dose, and you are going for the reference range that is between 30 to 300 nanogram per ml, or 94.2 to 942 nanomole per liter. That is the range. So anything above that, you contact your pharmacist or the physician on duty immediately. There will be an alert from the lab once the sample is taken, and a very high level of about 600 nanogram per ml is reached. There will be an alert from the lab. In pregnancy and vomiting, we don't go for chlorpromazine as the first medication. It is actually the last resort. And why that? All regular medications would have been used. like daclitine, Zofran, metoclopramide, promethazine, and so. So it is only when we are not winning with that we can use chlorpromazine in pregnancy-associated vomiting, like hyperemesis gravidarum. You can even check my channel for hyperemesis gravidarum. There's a full presentation on that. Because there could be jaundice in the newborn, associated with hypo or hyperreflexia, and we don't want that. Okay. Still, a pregnant woman with vomiting in third trimester, chlorpromazine can lead to extrapyramidal side effects in the newborn, and we don't want that, right? So we may not use it until we can't use any other medication to reduce the vomiting in the woman. Withdrawal symptoms that we may run into at delivery will include agitation, hypertonia, and maybe hypotonia. The child could come down with respiratory distress syndrome. There might be feeding disorder in this child with somnolency and tremor, and we don't want that for the new baby who has just arrived. Because of that, in third trimester, we keep chlorpromazine off the table. But if we have used all other medications to control the vomiting and we're not winning, and we'll have to use chlorpromazine, then we must explain to the mother that the new man or new woman coming might come with some conditions. That is, all these that I've just listed. With that, I've come to the end of this very presentation. Chlorpromazine is a pretty good medication that has been around for a long time. But nowadays, there are so many medications that are available that could be used with less side effects. And we can go for them first. Thanks for listening. Remember to share this. Remember to subscribe to my channel. I appreciate it.